Simulation Happy Hour acknowledges the land and the waters from which you are listening today. Welcome to Simulation Happy Hour. Sit back, relax, and let's talk about all things sim.
Right, welcome to another VIP lounge session, and we certainly have some VIPs in the house today. We have with us today all our Simulation Happy Hour hosts, Jenny Bassett.
Hello.
Jane Frost.
Hi.
Kerry Reed-Searle. And I'm Mel Barlow. So we have three VIP lounge guests today. The first up is Professor Jenny Rudolph, who I am sure for many needs no introduction. She's currently the Senior Director of Innovation at the Center for Medical Simulation and was previously the Executive Director of CMS. She is the lead author on the phenomenon that is With Good Judgment, Debriefing and Conversations. She's an organizational psychologist and proudly my long-term mentor. So welcome, Jenny.
Thank you, Mel. Such a pleasure to be here.
Next, we have Professor Kate Morse, who is a nurse practitioner by trade, but is now the Assistant Dean for Experiential Learning and Innovation and Associate Clinical Professor at Drexel University in the College of Nursing and Health Professions in Philadelphia. Previously worked at CMS, where she supported faculty development, strategy, and debriefing with simulation centers around the world, of which I personally benefited from her expertise and her friendship. So welcome, Kate.
Thanks, Mel. Happy to be here.
And last but not least, Dr. Mary Fay is a Senior Director for Teaching and Learning at CMS and adjunct faculty at Drexel University. She's previously held many academic appointments in both community colleges and universities. Mary's expertise is in faculty development, curriculum, brain-based teaching strategies, simulation, and debriefing and feedback. And in her spare time, she's also a CrossFit coach. Welcome, Mary.
Thank you, Mel.
So great group today. We're going to be discussing psychological safety, which I know has been discussed a lot before. But I guess from our perspective, we really want to understand and use your expertise to kind of ascertain, can we have too much psychological safety, and can it be at the disservice for our learners and for the realities of clinical practice? So just so we're on the same page, I guess I'm going to throw to Jenny R. And can you just, from your perspective, just explain what is psychological safety and why is it so important in SIM?
Sure. Thank you, Mel. So psychological safety is a construct that emerged from my field, organizational behavior, and it was actually really expanded and explained by Harvard Business School professor Amy Edmondson. And what was really interesting is Amy was actually a student of Richard Hackman, who was the leading teamwork researcher in our field for several decades. And Richard Hackman found that the teams that did best had certain inputs going into them, like fantastic structure, clear goals, adequate support, all that stuff. But Amy Edmondson found there was this conundrum, which is teams could have all those amazing inputs, but they could still sort of flounder if people didn't feel comfortable with each other. And I think that kind of intrigued her. So for her doctoral dissertation, she studied what was going on with teams, and she started exploring this construct of psychological safety. And what she found is that psychological safety is the feeling that you have that this environment is safe for interpersonal risk-taking. And I think in the health context, we could think about that as safe for interprofessional risk-taking. And what's really important about that, in my view, is when you're communicating across difference or you're interacting with other people who don't necessarily think the same way you do. What are the things that make you feel afraid, like you're going to be humiliated or you're going to be put down, or if you admit that you don't know, that will be held against you, versus a situation where you could do any of those things, speak up, say you don't know, ask for help, and be supported. And so that latter situation is the thing that Amy Edmondson found was most indicative of psychological safety being present. The last thing I just want to say, Mel, is for us thinking about psychological safety in health teams, which is another aspect of this, there's a very distinctive study that came out of Google and studied tens of their teams. And the most important predictor of team success was psychological safety. So how we think about creating teams where people can feel safe to learn at the edge of their expertise, I think is one of the things we could explore today together.
Thank you, Jenny. Mary, can I throw over to you? How do we then, if that is psychological safety, how do we establish it?
Great question, Mel. And just for context, much of the work that I do traditionally and still is with undergraduate nursing students and undergraduate nursing faculty. And so I love the part of Jenny's description of psychological safety where she discusses being willing to take some risks without fear of being ashamed or humiliated. And I think that for anyone who's learning a new skill, but especially for undergraduate nursing students, that is a real motivator or a real driver for their actions and the choices they make in simulation. And by that, I mean, if psychological safety is present, they're willing to dive in, give it a try, see what happens, and debrief it. If psychological safety is not, then they're defensive, they're withdrawn, and they don't want to participate. And so when I think about what do I need to do to create psychological safety in a setting like that, ultimately what I think is when I'm done with my pre-briefing and we're walking down to that simulation, I want them thinking, okay, I'm a little bit nervous, but I trust Mary. She's not out to get me. Nothing bad is going to happen to me. And so it's all those little things we do to build trust, which is relate to people on a personal basis, have a positive attitude, be welcoming, explicitly say to them, I do not expect you to be perfect today. Perfection is not expected here. This is about trying on the role of the nurse and seeing what it feels like. And then when we get to debriefing, we'll put all the pieces together. And so it's letting them know what's going to happen to them, letting them know that you're on their side, letting them know that you don't expect perfection, I think are some of the big bucket items that I think about when I think about creating psychological safety in the context of nursing students.
That's so good. Thanks, Mary. Kate, how do you establish psychological safety with your learners? What are some moves you do?
Sure. I think contextually, and we've been talking about this a lot of late with some of our learners, is sort of this idea of the value of discomfort in the service of learning, because I think if you lined up a lot of our current both undergrad and graduate students, because we just had a whole slew of graduate students with us, and we had this similar conversation that oftentimes I think people define discomfort as bad. That's not a safe space for me. If you started, went around and said, hey, what would it mean to you as a learner to be in a space where you could take those risks and appear like you don't know things and make mistakes? And increasingly the theme of like discomfort is bad. It comes up, and that they want to learn without feeling uncomfortable. So I think a lot of the moves that have changed for me, beyond the lovely structure that we all use and we think about in pre-briefing and the moves that Mary described underpinning the theory that Jenny described, is just sitting and naming that. Like, I expect that you will feel discomfort today. And that's actually good, because that's in the service of learning. It shouldn't be the kind of discomfort where you want to leave, but it's enough that, it's a little uncomfortable because you can't change without discomfort. You can't challenge your thinking without discomfort. And discomfort in the service of learning, not discomfort in order to, as Mary described, shame, blame, humiliate learners, but understanding that if they go in with hey, it's okay because I'm a learner and I'm going to feel uncomfortable and I'm trying something new and it's going to be potentially hard, changes, I think, their perception. And look, you can go around a circle because we had, 20 people and they will have very different descriptions about what that means for them. But I think I spend a way more time in pre-briefing, particularly if people are new to being in simulation, talking about like what is it that we all have to do in this to in order to engage in learning, and that what does that mean to you? Like what's your tolerance for that? How can, what can we do to support that? What we're not going to do is not give you feedback because that's not going to help you. That's not going to help you grow and develop. And if that's the expectation, like how can we sort of reset that before we go through that experience versus you coming to debriefing and being super surprised that there's clear, hopefully actionable feedback that might feel a little uncomfortable. So I think I spend way more time talking about that because I find a lot of learners labeling behaviors that I would look at and go, wow, that's super clear. That's great. And they're like aggressive, assertive. And I'm like, really? Wow. We come at that from such different perspectives. So we try and I'm not saying it works all the time, but try and just sort of scale that to what are we doing here in the service of learning? What can you expect? Not only just the fundamentals of the sim and things about who they are and where they are and what they're supposed to do, but also managing their own emotions around that.
Thank you. I want to dive shortly deeper into that concept of discomfort. Before we get there, so you talked about pre-briefing. So I've worked both in hospital-based sim centers and in higher education. Pre-briefing is clearly important in both contexts, but is there a difference logistically in how you do it? So you versus like hospital-based, you might see people once a year. They come to the sim center versus you have a class for 10 weeks straight in the same environment. And so often with kind of more novice academics, they look at the standards and they see, they need to do this full, half-hour long pre-brief when you've only got them 2 hours in a lab a week. I guess I'm throwing this out to everyone. Like, how are the differences in how we pre-brief and why?
Sure. I mean, I would say for people that come back all the time and, are regular and know the flow, they can practically pre-brief themselves. And that's great. To my mind, that's like fantastic. You're already down the path. So I don't feel the need to, like, I might do the same structure for, I don't know, 2 to 3 times till I know they're comfortable and they're hearing and they're they're able to listen to things and they know us. And then I'm going to refresh, like refreshing the basic assumption, refreshing, the same principles of who you are, where you are, and what you're supposed to be doing is really important. Is this, count for a grade? Is this formative? Who's going to know about it? Like all those things. I feel like you got to say every single time because it might be different based on what they're there to do that day. But I might not do I wouldn't do a 30-minute pre-briefing because they know it off by heart.
So Jane, Kerry, and Jenny B, do you guys have a script for your academics to say each time? Do you just rely on people knowing how to pre-brief to help establish psychological safety?
Hi, I'm happy to go next if that's all right, Jenny. We do have some training, but it has struck me listening to our experts today, and thank you very much. It's been really interesting. That maybe we also need to be looking at the psychological safety of the facilitators, because we do have this reluctance of people to actually do sim and to do sim properly. And perhaps that's because they're shown or they're worried about their being shown up or not doing it correctly. And maybe there's something around the educator and looking at how we prepare them and give them that psychological safety to take risks and to actually implement simulation that they might not be comfortable in. Do you have any thoughts about that? Is that work that you've done?
I think that's a wonderful topic, Jane, and it's something I happen to be very passionate about. One of the things I've been thinking about a lot is the place from which I come as a faculty member internally. And what I mean by that is, do I feel at peace with what is giving me credibility or what is giving me a sense of authority? And I don't mean authority over, but I mean, am I seen as an authority by my peers? Am I seen as an authority by my learners? And in my opinion, that authority can come from various things. It doesn't just have to come from, I know the most about how to manage this particular kind of anaphylaxis. It could come from, I am an expert in helping people learn in this team context. So, Jane, the piece, there's so much to say there, but the thing that I try to work with people most on and with myself on is, do I feel entitled to be sitting here? Do I feel I belong? Or am I auditioning to be approved of by my students and by my colleagues? Because when I feel like I'm auditioning, when I feel like I'm not accepted, and then that drives up my autonomic nervous system. I am not safe and social. And when I don't feel safe and social, that leaks. And so then that psychological, that emotional contagion degrades the environment for all. So I love that you brought that up. I think we need to do more about it. Anyway, those are some initial thoughts. I'm sure others might have interesting things to say.
That's super interesting.
Can I chime in for a second, Mel?
Go.
So I think I'll put my hand back down. High level performance online. I think it's such an interesting, and I don't think, Jane, I approached it in the thoughtful way that you brought it up. But one of the things that we did is we created, like, we have a number of sort of standard pre-briefing videos that go in their online shell. We have ones 10 minutes, and then we have a 5-minute one that when they come, both for high fidelity, and we have a standardized patient lab. So the sort of that nuts and bolts of the basic assumption, the lab, how you're going to interact, the like those elements, the standard elements, the faculty don't have to worry about, because they were, I think, very concerned they might come once a year, so they never felt really comfortable with that material. And then they partner with that and talk about why the students, because they're the course faculty, like, what are we here today and what are my expectations of you and what are we going to do? So they sort of get to do the faculty piece with married with it, because people were, I think, for the reason that you outlined, is they didn't feel good about doing it because they didn't do it enough for it to be comfortable for them. So when you say that, I think that is probably why we did that, but I didn't think about it at the time.
Yeah, I think what I try and encourage people in higher education to think about is pre-briefing is not just the bit you say before they head into the sim. Every bit of information you have shared with the learners about that activity before going in, from the learning management system to the unit outline is all the pre-briefing. And if you have inconsistent information across those different platforms because you've changed the activity but you've forgot to change the information about it in other areas, is going to lead to feeling uncomfortable and impact trust, and they don't know how to engage. So that consistency. And I think to Jane, like, how do we prepare our facilitators? I don't think we put in the same thought. Like often we're still creating activities the week before and then hand out the session plans to faculty like days before. Like, that's inadequate pre-briefing and preparation for them. And so no wonder they're feeling uncomfortable. Kerry. Thank you, Kerry. Jenny.
And can I just add to that? I think one of the differences here is that we don't have an accreditation process within Australia, and there are probably other countries in the world that don't have accredited facilitators, whereas, there are many countries that now have accredited facilitations. There's a specific training program. And so I think that's something that's really important. When Kerry said, we need a template. Well, if I've walked in as a casual staff member to facilitate simulation, I want to know what this organisation's doing. So I think that is important. And when you're teaching across many sites, a lot of universities don't just teach from one central site. We have a footprint that's quite large. So I think there are other really important aspects to think about to ensure that we are providing psychological safety for our learners and for our staff across all of those spaces.
Thank you. Can I change tack slightly? So years ago when, a decade ago, when we had all these or more fancy mannequins all came out, they were high technology, and everyone was kind of focused on the sexiness of the technology and kind of forgot about the underpinning pedagogy and importance of, pre-brief and debrief or feedback. And in some aspects, I'm kind of seeing this again with the advent of VR and digital simulations. How do we pre-brief then and establish psychological safety with those technologies if students are doing this asynchronously, or like how do we do that? Any thoughts?
It's very complex, Mel. I I'll say I think the value of pre-briefing shouldn't just happen, as you were saying, related to that individual learning activity. I mean, think of all the things I've taken from simulation to put into my course orientation. And, some of it's in my course syllabus, like the basic assumption. And those, so it has, I think, as you were saying, like it has to start at the very beginning. And if it's not there in the classroom, then it's not going to be there in VR, whether that's asynchronous VR or, everybody's in a shared space. And I think it's equally important to still talk about it, because without it, then distance the students. We're modeling, and this is in my mind, we're modeling for the students that the conversation and the relational aspect, which Mary often talks about, is less important than the, stuff, your avatar or whatever. I think they're learning modalities that can appeal to a lot of people, and they may be really, really helpful. And I think they still have to be bookended by pre-briefing and debriefing of entering in and synthesizing learning.
Yeah. Jenny.
Yeah, thanks for this question, Mel. I think we need to consider the cognitive load posed by any technology. And in my opinion, really excellent pre-briefing of anything involves the faculty having experienced that anything. So whether it's a mannequin-based simulation, an actor-based simulation, a Oculus Rift facilitated full VR, a flat screen VR, the instructor needs to know themselves what that feels like. And I think that is one of the biggest missings across all of our faculty. So many of us don't put ourselves in sims enough to know what it actually feels like. And I'm just going to give a really concrete example. I've been working with a group that uses voice and avatars to practice difficult conversations like de-escalation of a combative patient or things like that. And just like when I'm pre-briefing somebody around a mannequin sim that, you're not going to get the breath sounds you might expect, or the patient isn't going to diaphragm, so you're not going to necessarily see cyanosis and whatever. Similarly, when I pre-brief working with an avatar, I'm going to say there's a latency sometimes when you say something to them, they don't respond as quickly as a human. But if you can solve the problem in front of you, just like you would if you were facing a combative patient, I think the simulation will gradually draw you in. And if I do a good job of that, then when these funky, weird things happen that could break the fiction contract or break reality, it doesn't distract them because they remember and it was expected. So I think the foundational principle of thinking about their lived experience in the sim and helping them get into it and offload anything that's distracting is sort of the same as we've always done, but requires us to know the experience.
I love that, because often academics or educators are too scared to put themselves in the sim because they think they need to be the expert, yet we kind of tell our learners, go in, embrace it. And yeah, it's a bit...
Go in there and do the thing that I won't do.
That's so true. Yeah, that's great. Thank you for that. I want to get to, I guess, the conversation. So for me, I think potentially when you look at, and I'm going to talk about nursing, but I think this relates to anyone, but I just, as a nurse, see nurse graduates come out, their resilience levels are less, than in our day. And the attrition rates in that first, 1 to 2 years is really high. And I look at how we do sim now in undergraduate, it's predominantly skills based. We're not putting our learners in these kind of difficult situations of dying patients or cultural complexities and then we wonder why they struggle with the realities of practice. And so my question to you is are we potentially now, is the pendulum gone too far the other way? Are we being too psychologically safe and doing our learners a disservice? Jenny R., what do you think?
So I think this is a super important topic, and I'd love to hear from others in a moment about kind of inoculating learners and potentially the role of micro debriefing and knowing how to reflect on your own practice is a really important thing once you get into practice. So I don't want to miss the opportunity to hear about that if people want to talk about it. But to your question, Mel, can we be too psychologically safe? So I think what I would say, going back to Kate Morse's comment about tolerating discomfort in the service of learning, when we say we're being too psychologically safe, generally what that means is we are being nice and we are sugarcoating and we are deflecting and we are not providing safe but direct feedback about performance. And what I think is paradoxical, Mel, is when we get too nice, if you think of psychological, well, let's talk about it as niceness rather than psychological safety, a certain amount of meeting learners where they are, accepting that they feel risk, and we're helping them with that is really important. And I'm drawing an inverted U with my hand here. But once we get into sugarcoating, covering up, not giving clear feedback, what I think happens there is the learners discern it. And when they feel that it's about them guessing what you're thinking, or they recognize that you're protecting them from what's really happening, it causes a degradation in psychological safety in another way, because people recognize people aren't talking about what's really going on. So I really liked Vic Brazel and Eve Purdy's piece on the IceNet blog maybe 2 years ago, where they talked about safe, not soft. And so I'm just thinking maybe that's something for us to explore.
Great. Thank you, Jenny. Mary.
So Jenny spoke to sort of being nice with regard to the feedback and debriefing part of it. There's another phenomenon that I see happening a lot in simulation in especially undergraduate programs, which is during the simulation itself, students being told, if you get too stressed during the sim, you can just step out. And that's something that I think we need to be talking about, because I think that is not the right thing to do. Because in real practice, if they get too stressed, they're not allowed to step away from the bedside. And in real practice, if they have to take care of someone who had breast cancer and their beloved grandmother died of breast cancer and it's bringing up bad memories, they still have to take care of the patient with breast cancer. And so I think rather than us saying to undergraduate nursing students, if you get too stressed, you can leave, we should actually be, number one, bringing them along in simulation using a framework like the sim zones, where they gradually get used to the intensity of simulation in small doses, and we can support them through it through things like micro debriefing, pause and discuss. And I think we should have specific learning objectives related to some simulations that are specifically about decision making under duress, because that's what we're missing. And that's what they need more than anything, is how do I manage stress and still get my drug calculations right and still communicate therapeutically with the patient and still put together a good SBAR. And so when we constantly give them the you can step out anytime you want to, I think we're doing them a grave disservice. Now, I also want to say, I do think it's okay that if we say to the students, if you become so distressed that you cannot function, then it's okay to step out, but we need to put some parameters around that.
Yeah, so true. Very interesting. Kate.
So I love what Mary said around the micro debriefing and the pause and discuss as sort of scaffolding it through. Because early on, if you think a fundamental first year nursing student or a brand spanking new nurse practitioner, you're not going to say to them, so today your patient's going to die and you have to manage this, because that's not fair and that's not creating a safe learning environment. But to say, listen, you're going to start this, I'm going to come in at, predefined times, or you can, call for help and I'll come in and help you, all the way up to, yeah, by the end of this, you will be managing whatever is appropriate for their level of training. But I agree, you have to give them those opportunities. And those micro debriefings aren't just about, as Mary said, not just about what are you thinking, what are you noticing if you're working on the nursing process or differential diagnoses, but it's talking about, notice how you weren't able to access your thinking before I came in. Now, the beeping has stopped and we're just chatting here at the bedside. And now you're looking at me and you know the answer. That's because here your emotions were driving you. Here they're not. Your cognitive load came down. So what can you do yourself at the bedside in hard conversations to manage that? So we start to incorporate like those, what do you normally do? Like when you're in an argument or when you're in a stressful situation, well, how can you bring that here? So they can start to practice those self moves. Yeah. And to manage that, because I am 100% in agreement with you. We must prepare them It is not. It's not. We still at the United States have upwards of a 40% attrition rate for new nurses, and nurse practitioners are taking more and more responsibility. It is not always easy.
Yeah, and I'd love to hear from an Australian perspective, guys. In speaking with paramedics, they do this training. They actually have I've heard of simulations where, because it's very male dominated and often the juniors struggle when they go out on placement with senior male paramedics, and as a generalization, but they have these simulations about how to manage those dynamics in the tea rooms and things like that. Like, they put their learners in those situations and context to prepare them. I think, look, I don't have insight into a lot of higher eds in Australia, but Jenny, Kerry, and Jane, like, what are your thoughts? Because when you're predominantly skills focused, it doesn't give you really the opportunities to have these micro pauses and discussions when you've got a room of 30 students doing deliberate practice on skills. Like, how do you guys manage it? Or is there a gap? And I think this comes back to that concept of organizations investing in faculty development, right? To facilitate those conversations. I'm just conscious of time, but Jane and Jenny, thoughts?
Well, I think it's a problem. I think it's something that we need to develop the staff, and I think just talking through the psychological safety of the staff, maybe if we can invest in that, then we'll be able to get them to actually be, as Jenny R was talking about, confident and knowing who they are in the classroom, so that they're able to facilitate simulations more consistently. We have large amounts of numbers in nursing, so trying to get that consistency and getting everybody trained to do it is really difficult.
Kerry? Kate?
Mel, while you were speaking, it was making me sort of think about, there's probably some connection to feedback literacy here. And because in real clinical practice, I've had a variety of good feedback, bad feedback, horrible feedback, great feedback. And you can't control that piece, but you can, I think, teaching students how to build the skill of receiving feedback, and that's to discern, when it's feedback that you're like, okay, thanks so much, and feedback that's really going to help you, or feedback you need to rely on. I think that doing simulations with learners focus on building the skill of receiving feedback may have, and this would be a long-term connection, but because there's so many other variables, may have some connection to sort of their resilience in that first year in clinical practice, where it sort of feels like an assault on the census on a daily basis, because you're not an expert, so you're doing a lot of things that are getting feedback. Might help.
I love that. You're talking my language. I think, we wonder why our students aren't listening to us or listening to our feedback yet. We never ever teach them how to receive feedback.
Ever.
So excellent. Oh, such an amazing discussion. I could talk about this for hours, but I'm conscious of everyone's time. So thank you, Mary, Jenny, and Kate, for your really thoughtful insights. I know Jenny B has a final question for you.
So one of the questions we ask all of our lovely guests in our VIP room is, if you could be anywhere in the world having a drink, where would you be and what would it be?
It's happy hour anywhere.
All right, I'll take it. I'm sitting on the shores of Silver Lake in Barnard, Vermont right now, and I would be loving to have a cool India Pale Ale on the dock, right looking over the lake here.
Can't wait to join you for one of those, Jenny. Huh?
No, I'm on my way.
Can't wait to have you.
All right. Well, I'm going to second Jenny's beer idea, but I would be drinking a Shinerbach beer, which is brewed in Shiner, Texas. And, in honor of my Australian friends, I would be drinking it in Melbourne.
All right.
Thank you, Mary.
Come on down.
Mary, well done.
You
Well,
buy
I
that
have
in
to
Mary?
depart from the beer trio because I don't like beer. It would be a glass of Prosecco, Mel, just for you.
Yeah.
And I think one of my favorite places I've had a glass of Prosecco was sitting and the little tiny town of Mürren in Switzerland, overlooking an amazing, incredible valley and watching the sun come down on the mountains and just enjoying myself.
How amazing.
Wow.
Amazing.
I felt so psychologically safe when you asked me that question, Jenny B.
Very good.
Because Mel
Our
prepped
job
us.
is done. So thank you so much for joining us today. And just for our listeners, if you have a topic you want us to discuss, you can go to our website at www.simulationhappyhour.com and send us a message. And we look forward to having you join us for our next Simulation Happy Hour. Thank you, everyone, for joining.
Thank you, Mel.
Thanks.
Thank you, Mel.
Thank you, Mel.